Welcome back. John Bachman sitting in for Ed Berliner. Tonight, presidential candidate Ted Cruz and his close Senate colleague, Utah's Mike Lee, want to dramatically change the way the FDA decides which drugs are good enough for you and for me. For more on this now, we're joined by Arthur Caplan, Ph.D., Director of Medical Ethics at NYU's Langone Medical Center. Dr. Caplan, thanks for being with us.
Hey, thanks for having me.
All right, tell me a little bit about Ted Cruz's RESULT Act. Like a lot of Washington bills, it has a very cute acronym, but let's talk about it.
Well, what he and Senator Lee are proposing is that we start to have a reciprocal system with Europe, Canada, Japan, other countries. So if they recognize a drug as approved, then we would have it too, because the FDA would have to go along with what these other countries want to do. If there was a fight and the FDA still said we're not doing it, then the bill basically says Congress can meet and have a special session and vote as to whether this drug is going to be made available to the American people. Now, these are experimental drugs. They're trying to move them along quickly.
Right, and one of the issues you seem to take with this is that it kind of creates a race to the bottom, and it would allow pharmaceutical and medical device companies to find the path of least resistance in one of these so-called trusted countries, when they want to get one of their products to market.
100%. You got countries on this list like Malta, Poland, the Czech Republic, Hungary. What this bill would actually do is lead companies to shop until they got an approval somewhere in the world, turn around and say, hey, sorry, FDA, you're not going to look at this for safety and efficacy. You're going to go along with what the people in the Maltese Regulatory Authority say is okay.
Right, and that sounds like the argument you often hear for not selling health insurance across state lines. And insurers would find the state with the least restrictions that would allow them to do this. But on the other hand, though, it seems like this could, though, provide an opportunity to get a lot of drugs to patients who desperately need them. A lot of folks have died waiting on these types of treatments to be approved by the FDA.
Well, there are certainly is a need to speed up compassionate use access for people who are dying. There are a bunch of laws that have been passed in about 24 states, right to try laws. I'm not sure they're going to work very well, but we got to figure out a pathway, no doubt about it. This, however, is not the right pathway. This opens things up to lobbyists, to companies basically shopping regulatory authorities. And, really, Congress is going to override the FDA in terms of whether it thinks a drug is safe enough or efficacious enough. These are folks, most of whom I don't think really went past 8th grade science class. It wasn't their forte.
Well, to be fair, there are a number of doctors serving in the U.S. Congress right now. Tom Price of Georgia, to name it one, and Dr. Rand Paul is another guy out there. Does this bill have support from the Doc Caucus, as it's called, in Congress?
Yeah, that's a good question. Not yet. They're probably still thinking about it. This proposal literally just floated up. But I'll say it again. Here's two things that we don't associate. Congress, speed.
True. Fair enough. Fair enough. I can't appreciate the irony of using Congress as a mechanism to speed up the approval process for anything. Now, on the other hand, too, when you look at drugs in foreign countries, we often hear about the fact that they cost much less in those countries. Yes. Is there any kind of opportunity? Part of that is because of the high regulatory costs in this country due to the FDA and other reasons as well. But is there an opportunity in this bill to save patients money in the United States?
There isn't. So one of the problems we face is when you want that fast track for experimental drugs, insurance companies, federal payers, nobody covers these costs. I'd like to see some attention to helping people who are dying, their kids who are dying. They want to try and get a drug. They need help to travel. They need help to pay for the drugs. Nothing in this bill does anything to get past that. So the irony could be, yeah, you got an approval because it was approved somewhere in the world, but you can't get there and you can't pay for it.
Well, that problem certainly already exists. You don't see this going forward? Do you think this is maybe just a pipe dream for Senator Cruz?
I do. I don't think this one is going to move. It's just too risky to put our regulatory system in the hands of, these countries elsewhere. Look at the reaction we got when people said they wanted to use judicial opinions from other countries and work them into our Supreme Court. I don't think that's the pathway forward. Whatever we need to do, I don't think this is going to be it.
Yeah, it does seem to be a little bit of a double standard there. Arthur Caplan, thanks so much for being with us. A pleasure to speak with you, sir. More coming up here on The Hardline. Stick around.